This panel was recorded Friday, March 19, 2021, during the 15th Annual Public Administration Research Conference hosted by the Center for Public and Nonprofit Management at UCF. The recording picks up with Mr. Jared Truehart presenting Predatory Capitalism or Efficient Market Dynamics, City Government Reactions to Dollar Store Expansion.
Well, hello, everyone. I saw some of you last night. Good to see you, and good to see the new faces. My presentation is called Predatory Capitalism or Efficient Market Dynamics, City Government Reactions to Dollar Store Expansion. And I'll just dive right in. So the question of dollar stores, since the Great Recession, before that, but especially since the Great Recession, small box retailers, also called dollar stores, have expanded rapidly. City governments attribute the closure of local grocery stores and the creation of food deserts and poor health and low-income communities to dollar stores expansion, and they attribute a predatory aspect of it. Of course, not all, but those who have created the zoning limits to prevent dollar store expansion use that rationale. They do this despite the fact that there's really no conclusive evidence demonstrating that small box discount stores, dollar stores, cause food deserts, cause unhealthy eating habits, or even cause other negative externalities. City governments then create the zoning restrictions to limit dollar store expansions, and there's a couple ways they do this. I'll give a couple examples near the end of the presentation. So to define dollar stores, they're between 5,000, 16,000 square feet of floor space. They sell a variety of convenience items, but most notably, they sell food items, which are generally considered junk food. Most do not sell produce. $2 store chains, which comprise $3 stores. So Dollar Tree, Dollar General, and there's also Family Dollar. One of those companies owns Family Dollar also. They went from around 20,000 stores in 2008 to around 30,000 stores in 2018. The business model is to group their locations in a relatively small geographic area. And so they'll have multiple locations in these areas, and that cuts down on distribution costs. So, one distribution truck has to go only to one small geographic area, drop off goods. And that's one of the ways they offer low prices. They also have minimal staffing, which is another way they have low prices, but that has been thought to contribute to the dollar stores being hotspots for crime. So if we could talk about predatory capitalism just a little bit. In the grocery store context, this usually means price cutting, undercutting competition to try and force rivals out of business. The legal fining for predation amongst dollar stores is very hard to do. This came up in the 80s, where stores like what I think of as Aldi's, for example, they just had different stocking practices, different checkout practices. They could lower prices 10% compared to conventional grocery stores. Conventional grocery stores sued, called this predatory. The legal finding was that you have to be able to discern between competitive pricing versus predatory pricing. Very hard to do in the context of grocery stores. So city governments don't take the legal route, but they operate along that same rationale that dollar stores are undercutting traditional grocery stores, and that is causing the problems. So the argument for oh, you know what? I'm so sorry. I'm supposed to make this big, aren't I? Sorry about that. So the argument for the predatory practices is that the targeted expansion of and saturation of low-income communities is predatory. One executive for, I believe it was Dollar Tree, said that the average dollar store customer lives paycheck to paycheck and is on some sort of government assistance. So the argument from the cities is that they create food deserts in low-income communities, especially. There is a negative association between dollar store locations and grocers. So more dollar stores go in, grocers go out. Residents of food deserts buy food at dollar stores, and this food is usually high in fat and sugar, and it's generally what we would consider junk food. Dollar stores are also seen as hot spots of crime. They have certain characteristics that make them attractive to criminals. That minimal staffing was one. The some dollar stores often have low shelving so that you can see over all the shelves. For criminals, this is a good thing. You can see who's coming, who's going. So those are, and the bright fluorescent lights at night, and because of the locations, it just becomes hotspots for crime. And then they also create supermarket redlining, which is to say the presence of dollar stores comes to define a low-income community such that prospective grocery stores don't want to go into that community. So they drive away supermarkets from entering. Now, that there is some evidence for that, but there is a lot more evidence suggesting that it's free market dynamics that's driving dollar stores into low-income communities. The closures of grocery stores has not been attributed to competition from dollar stores. I've seen a couple studies that go through how some of the problems that grocery stores have compared to dollar stores. They deal with a lot more product. They require a lot more revenue. There's a lot more staffing. They deal with fresh produce, which is harder to manage. One study I read, the city wanted to keep, it was in New York, the city wanted to keep a grocery store co-op in business as it was going out of business. So they gave it $1 million grant. Despite the $1 million grant, the co-op still went out of business. So it's a stronger argument that grocery stores are just much harder to manage and require more capital income to stay afloat. Food deserts, they also predate the expansion of dollar stores. One study I saw showed that there were actually more grocery stores in low-income communities in the 70s and up into the 80s, and that trend started to shift around between the 80s and the 90s, so that there were less grocery stores in low-income areas and more grocery stores in high-income areas. So that switch shifted around that time. And I haven't read a reason why, but this is well before the rapid expansion of dollar stores. Urban sprawl, which is how compact a city or area is, and population density, they play a role in the creation of food deserts and locations of grocery stores. Local manufacturing can play a role. If manufacturing leaves a city, grocery stores will go out of business and dollar stores may go in that area and fill the void. There really hasn't been any causal links to establish between the presence of dollar stores and obesity. In one study that I read, they tried to see if there was a link between the presence of dollar stores and childhood obesity in Arkansas, and there was not. In fact, there was a not insignificant data showing that the absence of dollar stores in that area caused more obesity. So it's really just not much evidence for that. Another argument for dollar stores is that they're very convenient, especially in low-income areas and food deserts. But there's a very nice 5-year study showing that residents of low-income communities, and other communities as well, they will drive outside the food desert area to go to the grocery store of their choice. So they'll drive past one grocery store, they'll drive past the dollar stores to go to the grocery store of their choice. What's more is that people actually buy most of their junk food at grocery stores. And regarding the crime, dollar stores, they may be victims of the crime rather than the enablers. A good example of this is in Dayton, Ohio. Dayton, Ohio police have suggested that the dollar stores are hotspots of crime, but crime has not increased at all from, I believe I have from the year 2003 or from the year 2000 all the way to 2018. Crime has been fairly steady in Dayton, Ohio. So the dollar stores may not be the cause of the crime so much as just the latest congregation spot for the crime. So here's a case study regarding New Orleans. On your map, you see New Orleans East plus a little more. As of 2018, there were 36 dollar stores in New Orleans, 12 of them in New Orleans East alone. You see there's 14 on the map there, so that's a little more than New Orleans East. The complaints from citizens of New Orleans were mostly around the products being sold. They're unhealthy. They have toxins, the impacts on grocers, low wage jobs, especially compared to grocery stores, which generally pay better than dollar stores, the effects on property values, the unaesthetic appearances, crime, the unaesthetic appearances just being dollar stores were putting stuff outside the doors, outside the building, stuff like trash and just stuff to make it very unsightly. So the new zoning regulations that New Orleans adopted in response to that was to prohibit dollar stores from opening within 2 miles of each other, which, as you can see from the map, is probably pretty hard to open a new dollar store in that area that's over 2 miles from another one. They prohibit outside storage and they require cleanliness, especially in the parking lots. Here's another case study, Birmingham, Alabama. According to the mayor, to a presentation to city council, he says that 69% of Birmingham residents live in a food desert. And what you see on the right is a zoning ordinance, is the Healthy Food Overlay District. And in 2019, Birmingham adopted a zoning ordinance to create that district. The new regulations prevent new dollar stores from opening within 1 mile of each other. They provide more incentives for grocery stores to open there by offering more square feet of floor space. And they allow on-site sale of produce to encourage things like farmers markets, things like that. There's also they established a $500,000 healthy food fund even before they created the Healthy Food Overlay District. And that's all I have for now. Hopefully that's my first presentation. So feel free to tell me how I did. And I think I did before time. So we do questions at the end or questions now. Either way is fine by me.
Questions will start at the end after the rest of the presentations have gone. So we can save Mary's question once we get through the rest.
Oh, I got just on time. All right, awesome, thank you.
Hi, I can start next. I believe I'm up, so if I may have the screen share capability. I have a PowerPoint presentation. It says the host has disabled participant screen sharing.
Mr. Truehart, would you mind giving Mr. Henley the
Am I the host?
Yes, you're the host. So if you can make him the host now.
Try it now, please.
There we go.
Okay.
So good morning, everybody. My name is Terry Henley, and I'm a graduate teaching associate at UCF. I'm also a PhD student. In my second year, I have 10 years of government experience managing budgets for cities, working in budget departments, CRAs, and project management in the private sector. I'm going to discuss today and share with you some of my latest research on financial sustainability. In particular, we'll focus on Florida cities. It's a cross-sectional retrospective analysis. And it asks the question, can we serve future generations without raising taxes, issuing debt, running deficits? So the objectives for today will include 5 areas. I'll discuss the significance of the study in terms of its novelty, us being in another recession, also the innovativeness of the study in terms of its approaches and how it's different than other financial sustainability studies or financial condition studies. Also, I'll get into the approach, the theories that are used to inform the study, the specific aims, and the methods and how I chose variables. I'll get into the project long-term goal and discuss some of the feasibility issues and limitations. And I'll end with some prime references. So the problem that financial sustainability is addressing is whether smaller cities may be more vulnerable to financial distress in a COVID economy. The financial sustainability framework is believed to address or will try to address some of these attributes that could be of ill preparedness. The Pew Institute in 2013 did a study on the amount of state oversight on local financial condition for local governments and found that about half the states have laws on financial condition and monitoring local governments. And then out of that half, only about half of that half had lax oversight. So really there's only about less than a dozen that have strict oversight where the state's monitoring it. Also, an IRACA study in 2017 noted that cities did recover from the Great Recession in 2008. However, it could be a fiscal illusion because the financial statements may not provide all the data or the necessary indicators so that we can see not just current financial condition, but long-term financial sustainability of our local government's business models. One of them in particular that the study will address is the utility transfers. It's an indirect cost allocation method where local government general funds received funds or revenue transfers from utility departments for administrative things like management, utility billing, attorney fees, which is normal. But is this a stopgap so that we could plug inefficiencies or areas where there was revenue deficiencies? The fourth thing is that, the third is the prominent models. A McDonald study in 2017 also showed that some of the things that local governments rely on for financial condition don't really do that well. And it's mixed results, in particular, the two-wing solvency test, the 10-point Brown test, the ICMA trend monitoring system, even the Moody's and Fitch credit rating reports, from which many of us rely, may not show us the financial long-term. And luckily, the financial sustainability, it addresses some of the non-financial statement predictors that could possibly help determine or predict financial sustainability. Some of these things were are often the control variables in other studies, including the economics, the demographics, some of the politics. Some of those things that are control variables happen to be the predictor variables that worked out well and shows strong correlation in prior studies. So, and the problem for ill preparedness is research is focused on large county governments and city governments, but 95% of the local governments in the United States have a population of less than 50,000. In Florida, it's no different. It's about 88%. So the rationale for the study is recessions have the power not just to devastate, but also reveal financial condition. So did small cities, big cities, who recovered from the last recession? Prior research says yes, if you just look at fund balance, but there may be some of those fiscal illusions that are in there, or stealthy things under the radar that may have an influence. And also the number of financial emergencies in the state of Florida went down, but that could be attributed to the state legislation, which is less stringent now and lacks oversight. No, the answer to the question would be no. If you look at the mean size city of cities, how debt went up in a period after the Great Recession where there was supposed to be prosperity, the aggregate debt went up. Deficits, more than half or about half, have operating deficits, which is not unusual and can be reasonable and legitimate, but it's also noteworthy. And then the utility fund transfers. And this data was gathered from the general auditor from the state. So financial sustainability, its definition is the ability for governments to deliver services at the present without compromising the future. So can our grandchildren, our future generations, can they have the same quality of services without us at this current time going into debt, running deficits, and then as a result later, they'll have to increase their taxes and may have lower levels of service. It's called intergenerational equity. So the research abroad has been quantitative, domestically it's been qualitative. This research will be quantitative domestically. A recession happens approximately every 5 years. In the last 250 years, we've had about 50. So we can expect that perhaps this recession, future ones, this research could help inform future research as well as policy. This study is unique in that it complements other fields, uses non-financial predictors, focuses on local government in Florida, and it's unique in that it uses unassigned fund balance as the dependent variable, which is used for a lot of financial condition studies, but not for financial sustainability, which has used adjusted income statements in Europe. So, and it's also heavily influenced by two theories: common pool resource theory, which shapes the dependent variable of unassigned fund balance, which is essentially an environmental theory from Ostrom and Ostrom that is applicable to financial management. And it says that when you have a resource, a particular group that extracts from it, do they aggressively extract too much that they don't replace, and consequently other people that from that resource don't have it? In this case, the resource is the unassigned fund balance, which is the savings account or contingency fund. And then the resource view, it's based on Barney's 1996 study, and it explains why organizations succeed or fail. And it's a private sector model, though. And this next slide, this is essentially the study. I'm going to use a structural equation model. And on the right, you'll see 17 items. And these 17 items, they inform the latent variables, which are in ovals. These latent variables are categorized as either external or they're internal. So why do organizations succeed or fail? According to the resource view, it's either because of internal things within their control or external things outside of their control. Ultimately, it tests financial sustainability through the unassigned fund balance, which is all the way on the left. The structural equation model is a formative. It's not a reflective model. As you see, the arrows all going to the left, informing the items, informing the latents, and the latents being two layers, then informing unassigned fund balance. The research design, it's quantitative, retrospective. I'll use the 2017 data from all the financial statements from local governments. There's 343 with a population less than 50,000. And I'll use that. I got that data from the state auditor. And the research question, did smaller cities recover from the Great Recession? And can alternative non-financial predictors like the economics, the demographics, politics, can some of those things influence it? And then the specific aims, break it down. The first one is about the 17 items, and I'll use just simple regression, whether they have a relationship with the UFB. Then I'll go into the second stage after that bivariate analysis, and then I'll go into the structural equation model, and then test, do these latent variables influence UFB, or what about putting them in internal and external? Which one impacts the extent of financial sustainability more? This slide shows you my definitions of all the variables, where I have the data. I have more than half of it. The issues will be integrating all of it. It will be difficult to do, but the secondary data is readily available, which enhances the feasibility of the study. And then this slide shows you my project timeline. Currently, we're at the PARC conference in the very middle of the project timeline for March 2021. I already did the literature review, and I want to acknowledge Dr. David Mitchell for his assistance guiding me in the literature review and how to do one. And also I did the research design, which I just explained in the last slides. Data collection is an ongoing process. Analysis will come later along with the actual discussion and final review. Some of the limitations include the generalizability. What happens here may not necessarily be generalizable to all the FS or financial sustainability studies in Europe. Also, the data integration will be difficult. Variable selection, it may have some bias, but the literature review and prior findings of strong correlations between some of these items with sustainability will support that. And then there's some composite SEM assumptions, which is that it's heavily guided by theory and doesn't assume that the variables have to be strongly correlated. That's just the nature of it, but that's also some of its advantages. So the ultimate goal, and if I could end with this, is the long-term goal of this project is to infuse a sense of intergenerational equity. Can future generations have the same quality of life that we've had in the last decade without them having to pay for the sins of the father? So with that, I thank everybody, and I will take any questions. I appreciate it. And this slide shows you some of these prime references that have informed the research.
Hi, Terry, can you please make me back the host so that I can give the screen share options to everyone?
Yes.
Thank you.
I turned off my screen share.
We can see Dr. Mitchell's screen now.
Okay, yeah, looks like it's working. Should have mine up on the screen. Okay, I think we're just kind of taking the baton and running here. So thanks, Terry, for that presentation. I think it's a good conceptual research design presentation. Anytime you get done and you want to know what the results are, and you're kind of like being teased because you don't get to hear what the final product is yet. So seems like you've got a good project going, Terry. I look forward to the results. I am David Mitchell, Assistant Professor, Public Administration, University of Central Florida. There are some folks here that I don't think know my story, so just a little bit of background. I worked in city management for 7 years, 4 at the city of Kansas City, Missouri, in the management and budget office, part of the city manager's office there. And then also in Highland Park, Illinois, I worked in the city manager's office there as a management analyst. So I primarily deal with strategic management, budgeting, performance accountability questions, which is a lot of what I did in my former life as a practitioner. So largely taking the work I did in the field and adapting it to broader scale research questions. My topic today is on priority-based budgeting, which is one of those budgeting innovations that have come about that I became aware of as a practitioner, and I've been studying as a scholar. And really what you're seeing today is some of the first results from this fairly long-term project. I look forward to presenting this in greater detail at the Public Finance Conference in May. And hopefully here in the next few months, Dr. Sarah Larson and I, amongst others, will have a publication accepted on this topic as well. And I do want to acknowledge before I begin that Dr. Larson and Terry Henley, Dr. Suzette Miser, and Aria Malakowski have all been involved on this project as well. So while I've only got my name on this slide, it's only because I've done some additional work to show you guys today. But I do want to acknowledge all of the past efforts that have brought this together. So without further ado, let me go ahead and maximize the screen here. Let's talk about priority-based budgeting and its role in local government. So priority-based budgeting is the most recent attempt to try to reallocate public funds from lower priority programs to higher ones. Kind of follows in the tradition of zero-based budgeting, which was popular in the 70s, and has some elements of planning, budgeting initiatives, and it really is a response to what most budgeting tends to be, which is taking what your departmental allocation was last year, adding 2 or 3% to reflect inflation, and moving on. This is more of a broad-based, holistic attempt at reallocating funds that's not based on past allocations, but more on how well departments and programs align with current organizational priorities and community priorities. The reason why we're talking about this today is that this practice has been implemented by over 200 local governments in North America over the past 15 years or so, and it continues to grow. So while some from an academic perspective, some may doubt the effectiveness of priority-based budgeting, it's still something that we need to take note of and pay attention to. Because at the practical level, we're seeing this innovation at least being attempted by a number of leading edge, cutting edge local governments. And indeed, priority-based budgeting has been identified as a leading practice by the International City County Management Association and a best practice by the Government Finance Officers Association and the National League of Cities. So priority-based budgeting seems to be here to stay, and it warrants our attention to determine whether this is actually effective in the reallocation that it promises. Just to give you a background on the process, I don't expect you to be able to read all the words on this little chart over here, but it's an example of how the process is described by the leading consultant on for priority-based budgeting, which was formerly known as the Center for Priority-Based Budgeting. Is now they have a spin-off operation referred to as Resource X. They are the primary implementer of this initiative throughout cities. So it's a fairly simple process. First, you identify your available resources, and then you go through and identify the programs, the service delivery programs that you have as a local government, create an inventory of those, and assign a cost to each of them based on the prior year budget. And then there's also a parallel process where community leaders, perhaps the public, if they're involved in the process, go through a facilitated discussion to establish community priorities. What are the most pressing values, overriding values that drive this community today, and try to put some, try to sketch out what areas are the highest priorities from a kind of a conceptual perspective. And then this is usually done by staff or senior management. There's a scoring process that looks at the existing programs and determines how well those programs align with the priorities that were established by the public or the elected officials or the elected officials. And then those scores are used to drive budgetary decisions. The idea is that more money should be flowing to programs that have higher alignment scores, and money should be moving away from programs that have less. To the point where if something is so misaligned with community priorities that program could be subject to defunding or elimination. That's the idea. So from an academic perspective, I am looking to determine whether priority-based budgeting is effective in the reallocation that it promises from lower priority programs to higher priority programs. To do this, I'm looking at 32 of early adopting cities for priority-based budgeting, which includes 361 departments in those 32 cities. The Center for Priority-Based Budgeting, their process to go through the scoring process that we talked about previously is not to rank all of the programs 1 through 100 in their score order. What they do is they divide them into priority quartiles. So you're either in the first quartile, which is the highest priority, or the second or the third. And if you're really in trouble if you're in the fourth quartile, because those are deemed the lowest priority programs, and those are the ones that the budget decision makers will be looking at for potential cuts or perhaps elimination. We then went through the painstaking process. Terry's very familiar with this, of going through annual budgets and financial reports to pull the budgetary and financial data that we needed. We looked at the 3 years prior to priority-based budgeting being implemented and the 3 years after, because what we want to see is how the allocations to the various programs changed over time and how implementation affected that. So we needed a lot of budgetary and financial data to do that. Our analysis controls for political, demographic, economic, socioeconomic, and organizational factors for that particular community. And we employ difference in difference regression analysis to make our determinations as to how well priority-based budgeting is reallocating dollars within a particular organization. So the results, we do find in general that there is a significant reallocation of funds from lower priority programs to higher ones. So in general, there's evidence from this study to suggest that priority-based budgeting is successful in this reallocation. As you'll see in a little bit, the order of magnitude is not too large, but it is a significant change that warrants further examination. But we also find that some of these organizations are performing better than others in terms of priority-based budgeting effectiveness. And that's really the focus of today's study. So in general, these are all departments. I just want to give you kind of the overview before we dive into some of these subsets. The idea here is, and I don't know if you can see can you see my cursor moving or not? Yes, okay. When you look at these charts, if this goes according to hypothesis, we would see that the lower priority department should have lesser allocations than before priority-based budgeting. So afterwards, they should be less. The higher priority programs should be greater. And over here, we generally would expect lower priority departments to be either at zero or perhaps moving higher, indicating some sort of change has occurred with priority-based implementations. And what we're using today is what's referred to as Prosperity Change Score, which is a academic construct to look at how departmental budgets change in proportion to the overall organizational budget. So essentially, if you have a score of 120 for a PCS, what that means is that in that particular year, your proportion of organizational dollars is 20% higher than your department's average proportion of the organizational budget. So what it's looking at is relative proportion of dollars allocated for a specific department within an organization over time. And we're looking at a 6-year period here. So the findings here, we see about 1.39% less to the low priority departments, 1.74% greater to the higher priority departments. If you average this out, we're looking at about a 1.5% reallocation taking place due to priority-based budgeting implementation. So this is a significant result statistically, but from a practical perspective, is 1.5% really moving the needle? And that's kind of a question that we can leave, well, for either future discussion or for the organizations to determine for themselves. That also has to be weighed against the cost of implementation. There's a lot of time and effort that goes into doing those steps that I described before. And you may find these organizations may find that going through all that work isn't really worth a 1.5% reallocation. So these are kind of the broader issues to consider. But from a statistical perspective, this is a significant change in allocation. But what I'd like to do is look at how how different types of organizations are responding to priority-based budgeting, and see if there are some organizations that do better than others. So I've subset this data by a number of variables, and I can kind of provide a little bit of theory about why we look at the ones that we do. These first two slides talk about intergovernmental revenue coming into the organization and also capital expenditures. And the idea here is that if you're relying a lot on governmental grants or have a lot of money invested into capital expenditures, you've leveraged your budget, highly leveraged your budget into committed projects. And so the amount of money you have to spread amongst operations and reallocate amongst operations is less. And so the idea here is that these leveraged organizations may respond differently to priority-based budgeting. And what we do find is that there is this statistically significant difference for those who have intergovernmental revenue share of over 17%, which is the upper half of this data set. The median value for this is 17%. They are seeing about 2.2% less for their lower priority departments and over 3% increase for their high priority departments. So if you look at this, you're looking at 2.5%, 3% reallocation, which is greater than the general finding. So the idea here, and it mirrors with the capital expenditures as well, these values are greater than the general findings, that those that have highly leveraged budgets are seeing more success with reallocation. And what that says to me is that there's more competition for dollars in these organizations, and that priority-based budgeting is providing them with a mechanism to kind of facilitate that competition and make sure the dollars are going to where they need to go. We look at some demographic subsets as well, and the younger communities tend to do better with priority-based budgeting. Again, we're seeing 1.97% less for the lower priority departments with those with an average citizen age of less than 37.5, which is the median value. And we see that those dollars aren't necessarily going to the higher priority departments, but they are being cut from the lower priority departments. That means these dollars can be moved into capital, could be moved into other non-operating expenditures. But they are at least showing some effectiveness in getting dollars out of their low priority departments in communities where the average age is under 37.5. I'm not sure where I'm at on time, but I'm going to just keep rolling on until I see a prompt.
You're actually just about done. Sorry, I put it in the chat.
Oh, sorry. The chat didn't come up for me on my screen. I'll get to wrapping up here. Thank you. For Midwestern cities, it's very interesting. This was probably the strongest finding, is that 3% reallocation away from the low priority departments in Midwestern cities. Western cities were pretty average, and the southern cities were actually saw higher allocations for their low priority departments. So something's going on with the southern cities that we need to look at. It could have to do with the professionalism found in those local governments. And we also find that the more conservative, politically conservative cities are seeing vast success, cutting their low priority departments by almost 3% and increasing their higher priority departments by 5%. Also, smaller and larger cities are doing better than the kind of the average population. So does priority-based budgeting work better in some communities than others? The evidence here points to yes. More effective in more youthful, politically conservative, smaller or larger cities. The ones in the Midwest are doing well, and those that are extensively leveraging their budgets are doing well with priority-based budgeting. There's also some evidence to show that priority-based budgeting is working well in cities that either have high or low levels of income, political partisanship, debt, or racial diversity, but those were not statistically significant. You see my conclusions here. We see that priority-based budgeting has demonstrated some ability to reallocate funding, about 1.5% of operational funding. The effectiveness does vary on the type of community and the best outcomes we've talked about already. And as always, more research is necessary to offer firm conclusions. With that, I'm happy to take questions and comments after the final presentation. My contact information is here if you wanted to elaborate on your feedback. Thank you.
Okay, hello everyone. My name is Jenna Tyler. I'm a PhD candidate here in the School of Public Administration at UCF. And today I'll be presenting a paper written by me and my co-authors listed below. That's all about floodplain managers' perceptions of community flood concern, mitigation, preparedness, and response. And we're specifically looking at here in the United States. Okay, so as I can see for most of us on this call, most of us are here living in the great state of Florida. And so we are all probably well aware of the potential for flooding, especially as it relates to hurricanes. And if we think about it across the United States, flooding has and continues to be the most disruptive and costliest natural hazard in the US. For example, recent data suggests that roughly 80 people are killed as a result of flooding each year. And in addition, data has shown that flooding typically costs the United States roughly $8 billion annually. So flood risk management occurs at the federal, the state, and the local level, but it's primarily at this local level where the bulk of flood management decision-making occurs, and specifically communities participating in the National Flood Insurance Program, or the NFIP, which we all might be more familiar with. It's a federal government's way to help homeowners reduce the potential impact of flooding on their home. And so these communities that are participating in the NFIP are required to identify a person to serve as the floodplain manager. And the primary function of many floodplain managers is simply just manage, well, I shouldn't say simply, it's a detailed task, is all about managing the strategies related to addressing flood risks. So the purpose of our study is specifically to uncover floodplain managers' perceptions of their community's ability to mitigate, prepare, and respond to floods. So more specifically, we have 3 research questions for our study. The first, what are floodplain managers' perceptions of their community's concern for floods? The second, what are floodplain managers' perceptions of their community's ability to mitigate, prepare, and respond to floods? And finally, what factors support and undermine floodplain managers' perceptions of their community's ability to mitigate, prepare, and respond to floods? And so to help answer these questions, we look back on previous flood risk management studies, and we began by thinking about the 3 components of flood risk management. The first, risk analysis, which is primarily the process of determining a flood hazard, the vulnerability of floods, and essentially, we can think about this as floodplain managers using different instruments, such as risk maps, that provide information like the probability of floods, water level. So really just analyzing the risk of flood. Risk assessment, which is kind of the main focus of this paper here, refers to the process of understanding individuals or collectives' flood risk perceptions and concerns. So if we think about risk perceptions, we're generally meaning subjective judgments about the probability that a threat will affect an individual or a community. And then finally, risk reduction is really just the use of interventions to manage flood events. So things like installing levees or seawalls and developing flood response plans. But again, this paper today is really focusing on that risk assessment because we're looking at perceptions. So as previously mentioned, as one of our research questions is to determine the factors that are impacting these perceptions. And so again, we dive into the current and existing literature to find out what factors are salient and what we should be including in our models. So in general, extant literature shows that personal characteristics, flood experience, and proximity to water are significant factors when it comes to flood perceptions. So in terms of personal characteristics, we're thinking things like gender, race, age. Studies have shown previously that women typically have more concern over risks associated with natural hazards such as flooding, while men, on the other hand, are typically less concerned. We also have seen in prior studies, and this is not too surprising, but if you have prior experience with flooding, you're more likely to be concerned or have a higher flood risk perception. And then again, proximity to water is also fairly not too surprising, given that if you're more closer to water, the likelihood that you might be experiencing flooding arises. So if we think of people living here in Florida or in Texas, are going to be perhaps have higher flood risk perceptions than somebody living in the West. All right, so now I'll dive into the data and methods that we use to conduct our study and to answer those three research questions. So first, it's important to know that the primary purpose of this study was to first understand how communities that participate in a program called the CRS differ from those who don't participate in the CRS. So briefly, the Community Rating System Program, that's what CRS stands for, is a voluntary federal flood risk management program where communities can opt to participate in the program. And when they do, individuals within their community are going to receive reductions in their flood insurance premiums. So essentially, as they're engaging in this program, they're implementing additional flood risk management activities to try and reduce the flood loss. And as a result, the federal government then reduces flood insurance premiums for individuals and homeowners in that community. So that was the initial understanding or the initial purpose of this data that we're using. And having that understanding is important because you'll see why then were some of the findings at the end, which we'll get into. So again, just understanding these floodplain managers' perceptions of their community's ability to mitigate, prepare, and respond to floods, that's a secondary purpose, but still a very important one. And we're excited to share the results here today. So to identify the communities that we're going to be interviewing, we first took a random sample of 100 communities from 21,804 NFIP participating communities, for which we had participation on whether or not they're participating in the CRS. So then for each 100 communities that are participating in the CRS, we then identified 100 communities that are not. And these 100 communities that are not participating in the CRS are essentially identical or can be viewed as clones to those communities that are participating. So for example, one community, they'll have certain flood risk and demographic characteristics and participate. The other community, very, very similar flood risks and demographics, but they're not participating. So that's how we were selecting these communities. And so in total, we ended up with 100 CRS participating communities and 100 non-CRS participating communities. And so essentially, all that's to say is that already we have this understanding of who's in our sample, right? And we need to kind of go into our analysis of understanding that 100 of these communities already are participating in this federal flood risk management program, and the other are not. But in total, we have 200 floodplain managers that we're using for this study. All right, so now we'll go into the variable measurements. So our dependent variable, we have 3 of them. The first being perceptions of flood mitigation. And this was measured by asking individuals in an interview forum to please rate their community's mitigation for flooding on a scale of 1, which represents very poor, to 5, which represents excellent. And then the same goes for perceptions of flood preparedness and flood response. We also included 5 independent variables, so things like flood concerns. We want to see are individuals or floodplain managers that perceive their community to be more concerned about floods? Are they having higher perceptions of their ability to mitigate, prepare, and respond to floods? Another independent variable is flood problem, so the extent to which flooding is a problem in their community. And then we also include, again, CRS participation, which I was just talking about previously. And then how many full-time employees are in the department, and then how long that person has been operating as a floodplain manager. All right, so now we will move on to the results. So as we can see here, the majority of respondents were male, middle-aged with a bachelor's degree, and about 38% of them had been working as a floodplain manager for about 3 to 8 years. And this is kind of what we expect based on previous studies. Nothing too surprising here, just for sample statistics. So now when we think about floodplain managers' perception of their community's concern for floods, in general, we're finding that the majority are either very concerned or somewhat concerned. And then because the study, we used interviews to conduct the study, but we gathered both quantitative and qualitative interviews. That makes this study fairly unique because we're also able to qualitatively explain why these floodplain managers selected the response that they did. So in general, those who selected that they were very concerned or somewhat concerned about floods, the primary reasons for selecting that answer is due to the presence of floodplains in our bodies of water, which again, similar to previous studies that we went over in the literature review, as well as prior flood experience. When we think about mitigation and floodplain managers' perceptions of their community's ability to mitigate floods, again, we're seeing overall good perceptions. People are perceiving their community's ability to mitigate and prepare for flood, or just in this slide, mitigate floods as excellent or good. And the primary reason for doing so is they're citing their investments in flood protection measures, as well as their flood ordinances, standards, and regulations. And as we keep going through these, the next one in terms of preparedness, again, very similar findings. We're finding that most are perceiving their community to be very prepared or somewhat prepared for floods. And the main reason for this preparedness, this high level of preparedness, is because they have established policies, plans, programs, and procedures, as well as that they haven't experienced too many flood events in the past. So they're kind of attributing their ability to prepare in that they're not really experiencing floods. And then when we think about response, the majority of respondents reported their community's perception of their community's ability to respond. Again, excellent and good were the highest answers. So we're seeing a lot of similar results across the 4 dependent variable or the 3 dependent variables. And the majority of the people who selected excellent and good cited the availability and quality of their personnel. So they're really attributing their ability to respond to the people who are in charge of responding. All right, so now we'll go into our regression model where we're trying to determine the factors impacting these perceptions. And so first, we see flood concern is only significant on the mitigation dependent variable. We see CRS participation, on the other hand, is significant across all 3 variables. So we're finding that communities that are participating in that federal voluntary program are experiencing higher perceptions of flood mitigation, preparedness, and response. And then we see education is negative and significant for 2 of the dependent variables, so flood mitigation and preparedness. So when we think to conclude the study really aimed to understand floodplain managers' concern for floods, as well as their perceptions of their community's ability to mitigate, prepare, and respond to floods. And we think the study offers a few important contributions to the flood risk management literature. For example, quantitative analysis, they provide insight on communities' level of concern about floods, as well as their current capabilities. And it's interesting that we included communities across the United States. And then the qualitative results provide information on why these floodplain managers selected their rating. So using both of the quantitative and qualitative, we're really able to have a better understanding of these perceptions. But of course, future research is necessary to have a holistic and better idea. So future studies should supplement these perceptions with more objective measures. And this should also aim to include other objective measures in their models to potentially determine the impact of these perceptions. And that this work is based off the NSF. So we are grateful for the funding that we received there. And that concludes our presentation. Thank you.
So we have until 12:15 for Q&A and discussion. And it looks like earlier, Mary had a question for, I believe, Jared, Mr. Truehart.
Hello, Mary. I'll read your question out loud. It says, did any of the research point to a lack of transportation options such as public transit for the dominance of dollar stores in clusters in low-income neighborhoods or creation of food deserts? The short answer to that is no, not really. So there's a theoretical, hypothetical reasoning, which is that low-income communities, people don't have a higher prevalence of people don't have privately owned vehicles, so they have to walk here and there because they're low income. As such, they go for more convenient options, which may be dollar stores. In the 5-year study of transportation for food shopping habits, they showed low-income communities, on average, people drive, I think it was 1.6 kilometers from their house, and the average food store near them was 1.2 kilometers. So at least on average, they drive past a food store to go to another food store of choice. And there wasn't much data showing that people without privately owned vehicles tend to shop at dollar store locations because they're more convenient.
Jared, I might add to that. You'd kind of had asked yourself the question about why the shift in grocery stores back in the 70s and 80s. I think that there's probably some evidence in the literature, that a lot of this did with the consolidation of grocery stores, that franchises started buying up competitors when they would come into a community and close them down. So consolidation is probably one of the big reasons for that, moving them out of those neighborhoods.
That's one of the things that I also thought. I tried looking at if there was a difference between mom and pop grocery stores versus bigger chain grocery stores. There isn't much existing literature on it, but it seems to me that mom and pop businesses just went out of business more during that time, and the chains expanded more during that time. Both happening simultaneously, and maybe one being the cause of the other.
The kids didn't want to take up the family business.
Yeah.
Jared, this is Dr. Stevens here, Dan Stevens. A few years back, a colleague of mine, Vanessa Littleton, and we both did a presentation at the ASPA National Conference up in Chicago on this very topic. My forte is basically transportation policy, hers being public health. And we actually looked at this. We examined this in Central Florida, specifically about Lynx, our regional transportation partner, and the adverse impacts to communities of color here in Central Florida. And basically, we looked at the grocery store. That was one of the primary concerns, not only grocery store chains, but also access to healthcare through, down on Orange Avenue, the hospital district and things like that. And we found some pretty significant impacts, attributed to the lack of public transportation options. It's just something I think outside of this conference we could discuss. I could share our findings with you if you're interested.
Sure, I'd be happy to discuss that. What I've seen, though, hasn't suggested that food deserts lack public transportation. That doesn't seem to be the defining factor. It seems to be more hypothetical that low-income people don't have cars, per area, don't have as many cars per area, so that they shop more conveniently. They shop at corner stores, dollar stores, etc. But even the research I've seen shows that people will travel, not just drive, but travel. So including by public transportation, 1.6 kilometers to their food store of choice. And of course, I didn't look at things like public health or anything like that, which would complicate it. Was outside the scope of what I looked at, but it's an entirely different dynamic.
Understood. And there is one other component you might look at, which is the introduction of mobile buses, food buses, where they actually go in and they serve as a proxy for these communities, where they say, okay, well, we're going to actually have a bus full of fresh produce or whatever, and we're going to come to your community. So that way they kind of shorten that distance. The downside of that is that you've got to be there at a particular time. They're not readily available like a standalone store. So again,
one thing I did look at in the paper there, the paper is like 30 pages long, so I couldn't include a lot of it in the presentation. But one thing I did look at was some public incentive programs to shop at local farmers markets to buy more produce. And these are specifically for low income communities. And the results are not great. And the evaluations of these programs are flawed at best. And there's difference in differences studies that I cite where supermarkets move into low income communities, and what it shows is that the business at those new supermarkets don't drive business away from dollar stores. They just drive business away from other supermarkets. And there's in St. Louis, Minnesota, there's another comparative study showing that people want to shop at dollar stores. They'll just do so. It has nothing to do with it's more about the demand for the products being sold rather than any sort of predatory targeting that causes these food deserts.
I'm going to say, I noticed that Marianne also had another question for Dr. Mitchell. Do you want to ask that, Marianne?
Yes, I can. My question, Dr. Mitchell, was I was interested in how some of these communities set their priorities. You had mentioned that in some cases the public was involved, and I wondered if you could share any examples or had any more information about how they went about setting the priorities that they then use the budget for.
That's a great question, actually, something that I plan to look at more in depth down the line. What I can tell you is that the consulting group that's involved with a lot of these, they primarily left the priority setting process up to the particular community. And it really runs the gamut. So in some places, they'll just use the existing priorities that have been established by the council and run with those. In other cases, it's a purely staff-driven exercise. So the elected officials and the public are not involved at all. It's just an internal staff exercise. The primary model is usually the city council will either do some sort of retreat or have some sort of deliberation and identify those through their decision-making processes. But what is most interesting is that there are a number of organizations that have engaged the general public in this process. They have promoted it heavily. They've tried to make it a community-wide experience. And they've used different methods for doing that. In some cases, they will do budget workshops to kind of explain the context of the financial situation of the community, and then work them through a facilitated discussion to have distill priorities. In other cases, it's kind of more planning based, kind of using the planning models for citizen engagement to try to tease out those priorities. And in other cases, it's online interactive discussion with voting mechanisms. So there's a lot of different ways that those priorities are determined, and it is probably the most important part of the process because it drives the whole alignment scoring after that. So I guess the one I failed to mention is that other communities have incorporated this as part of a strategic planning process. So they've identified their priorities as part of strategic planning, and then they kind of have their strategy planning go along the same lines as the budget, and they kind of move forward together over time. So a lot of different models. There's nothing really out there to say that one has worked better than others at this point, but it is something that's on my docket for future research. And when I do this presentation, that is actually probably the most asked question, is the citizen engagement component. So people are interested, and I look forward to diving into that further.
Hey, David, I might add to that, where I'm from here in Texas, in Frisco, one of the fastest growing cities in the United States, probably over the last 2 decades. When I moved here in 2010, there was about 116,000 people, and today it's over 200,000. So very, very, very quick growth. The school district moved to the priority-based budgeting model after a very, very high need because of all of the influx of people. The voters turned down a bond election so that they couldn't build buildings. And they moved to this priority-based budgeting. And one of the ways that they involved the community is that they put together a citizens, a community task force, if you will, or committee, which I served on for 3 years. And they would they brought a lot of options to the committee, and the committee established the priorities for that. And that they went through and looked at, in terms of what goes into building schools, what resources were available and other things like that. And then the community started to set the priorities as to what they thought was most important and how that they should go about doing it. One of the big arguments, initially Frisco, they wanted what they called a small school model, which is a high school model. Basically, they want all high schools under 2,000 students or at 2,000 students, compared to like Allen High School, which has 12,000 students, one high school. And so one of the big things is, did the community still want that? That type of a model. And it was a great exercise for the community. There were probably about 40 people on that committee, and they would break off into smaller subcommittees and stuff, and they would meet once a month, I think, over the course of a school year. And it really, on one hand, it was a big PR thing too for the school district, because they got a lot of this information out and let the citizens come in and participate. It's 11 o'clock. It worked really well. So maybe we should sit down and talk about that, in the future. That could be a good collaboration, is just some type of an experience like what the school district went through here. So.
Definitely. I think this area is ripe for a lot of research because there's so much variation in how many of these governments, the approaches they took. And it's also, your point is also a good time to emphasize that it's not just municipalities that have been doing priority-based budgeting. A lot of special districts, a lot of school districts, So when I say local governments, I'm being inclusive of all types of local governments. It's been expanding into different fields. The other point I wanted to make, because you reminded me of this, is that priority-based budgeting isn't just for cutting either. It can be used for targeted investments. So communities that are growing and have an abundance of resources and trying to figure out where they should direct it have used priority-based budgeting. It's not just a budget cutting model.
You think it's a good model for universities?
That's a good question. It's got to be better than what we're working with right now, right?
I was going to say, not if you're in one of those obscure majors, you know, that that seems to be a target of a legislature.
That's true.
Actually, this is Dan Stevens again. We still have time, correct? We've got 15 minutes, I think, right? Okay. It's good that we have Mary Ann Horn here from Metroplan Orlando, a regional entity that grapples with this on occasion. For example, this is a collective of the Tri-County area, Orange, Seminole, and Osceola counties, all the 20 municipalities that are within there. And the way Metroplan sets it up is that, your representation on the board is dictated by your population. City of Orlando is the largest city in Orange County, Apopka is second largest, and so they get a seat at the table, as does the county. And then all the other entities, they're one of their 13 cities within Orange County. So the other 11 cities have representation on the help me out here, Marianne.
Municipal Advisory Committee.
Yes, thank you. So they all those other cities all are represented on a subcommittee. The problem is, you've got scarce resources, and everybody that's sitting at the table is vying to get their project funded. And so they've got to sit there and face these other people that are looking to, take all those scarce dollars and try and make it work at a regional level. I was actually kind of messaged directly to Marianne. They actually have, we've established some processes in the past where you try to do something similar to this, the prioritization process before it gets to the board, where we try to figure out how is this going to work. You get a lot of the politics in there. I think, David, as you mentioned, I forget exactly the jurisdiction where you have the politicians and you have everybody else out of the room and you just have staff working on the problem. A lot of times that's what it takes, but then again, you have those people that agree this is unfair. We want representation. Thoughts on that, David? I mean, the balance, I've heard all the pros, and I really liked your presentation, but you think is this going to survive barring that political involvement? When that's
what I like about priority-based budgeting in theory is that it kind of is a facilitator for all of the various discussions that happen in the budget process, because it provides objective information of alignment based off of perceptions of managers and perhaps elected officials as well. So it gives you something hard to work with, but it allows for the political process to have that information inform the deliberation. So the priority scoring isn't the end all be all of who's going to get money. It's designed to be informational to facilitate the decision making process. So what you did spark with your comments is that really what priority-based budgeting is, to me, is an extension of what has been used a lot in capital budgeting, which is capital-based prioritization processes, which are like citizen committees or scoring or some of these various processes that try to take some of the kind of anecdotal political processes out of the way and be more transparent about what are our priorities, how do these projects or how do these operations match up with our priorities. And so everybody's working from the same set of information, and hopefully that facilitates the discussion a little bit better than what your normal political process might do with behind the scenes conversations and back scratching and these types of things. So I think maybe the biggest benefit is that it's using some sort of objective information to steer the process, and it's also making it more transparent. And by doing that, I think that's a lot in line with what a lot of cities have done with their capital budgets, because those got overly political as well, is try to provide some sort of a scoring prioritization process and a mechanism for more transparent discussion of priorities.
Thank you.
I have a question for you, Dr. Mitchell. The results for the Republican versus Democrat seemed fairly stark. Do you think that's for ideological reasons, or do you think it's just the demographics of the cities that you got data from?
Right. So this is all done in multiple regression analysis. So we try to control for all of these, extraneous theories. So this should be really the independent influence of political ideology within that community. And so to me, if I look at that, and I don't have any sort of qualitative research to back this up, but if I was hypothesizing and looking at this, I would say that these conservative communities are more fiscally responsible, and typically, or they're more interested in fiscal responsibility, let's put it that way. And that this sort of process would be more appealing to conservative elected officials in terms of being able to perhaps shrink the size of government and move money into programs that are higher priorities. This does set up the possibility for program large reductions in some programs, or even elimination. So that's something that might be appealing to a fiscal conservative as well. And so it's in line with what I would expect from a political ideology, that those that are more conservative in ideology would be more interested in trying to do this reallocation and use a process that fostered that. But those are kind of my general thoughts. I don't have kind of the qualitative evidence to back up that theory. That's looks like future research for me, or anybody else that wants to jump on it.
Okay. I had a question for Terry, and I know also, I think Terry has a couple of questions as well that he wanted to ask. But Terry, what do you expect on your findings on small towns or in cities here in Florida? Did they recover or not?
What I expect is, first, on the individual 17 items, I expect that small cities that have a utility will be able to brace for fiscal shock much better than small cities without a utility, because that cost allocation method that can be a stopgap. However, there could be super long-term consequences of not being able to fund the capital infrastructure for a water plant, for a stormwater system, and that can be issues down the road. I also expect for of the two constructs, internal versus external, I expect for the internal factors to influence financial sustainability more than the external. And what that means is it answers an ultimate question. Am I a victim of the economy, or can I do something about it in terms, not as an individual, but as an organization? Thank you for your question.
I was going to just comment. We recently saw in Texas too what happens when you choose not to invest in your utility, and plan for extreme events.
And I can ask my question now.
Yes, go please.
Jenna, I enjoyed your presentation. In particular, I was interested in the methodology. I liked how you created two groups to compare. Was that you? Did you create? Can you talk about how you created the two groups? Was proximity score matching used? How did you come up with what's comparable?
That is a great question. Dr. Steig, do please feel free to jump in, because this was probably the most complicated part of the project. And we actually relied on one of our co-authors, Dr. Doug Bunin at IUPUI, to do the majority of this work. But essentially what we did is we looked at all of the communities that are participating in the NFIP. And then we randomly selected 100 of them. And then we looked at different covariates. So their flood risk, their number of people, the population, age, things of that sort, to try and find the specific matching. I can't get into specific details on how exactly that was done in Stata. But Dr. Steve, do you have anything to add there?
You're muted.
Oh, Dr. Steig, you're on mute.
You're on mute. We can't hear you.
I'm sorry about that. So thank you, Jenna and Terry, for the question. As Jenna said, this complicated procedure, was done by somebody that's way smarter than me. So I'll try to explain it to you. So what happened is that we use what's called propensity score matching technique. So he used that to kind of identify communities. So the first thing he did was to randomly select 100 communities that are participating in the CRS. In order to participate in the CRS, you have to be participating in the National Flood Insurance Program, and that's the 2021, roughly 22,000 of them. We have information on them. So from that, we randomly selected 100 that are participating in the CRS. And then using propensity scoring matching technique, we try to look for identical communities to the 100 communities. So identical in what respect? Using variables that the literature have already showed to predict participation in the CRS. In other words, a clone, for instance, or sister community will be a community that is exactly alike, is fairly alike in terms of flood risk, population density, things like that. And so we kind of say, okay, this is a community that is participating, number one. This is a sister community. They are alike. And the sister community could also join as everything in terms of covariate or characteristics to join, but it just didn't join. That's the only difference between the two. So instead of having just one sister for each community that is participating, we created 4. Why? Because if the first one, we call them up to interview them, they don't pick up the phone, we go to the next clone, we go to the third one, and then the fourth one, eventually, but luckily for us, we're able to get matching people to pick up the phone and have matches for all 100 communities. So that's best I think I can do without going to all the complicated calculations that Doug did. And we did, and after that, one of the things that was cool that Dr. Noonan did, Doug, was to now check to make sure that the communities that we identified, the clones, how different are they to their sister, to the 100, okay? And he found that they were very, very similar. I mean, the difference were very insignificant, to say. In other words, we have good clones for the 100, okay? Thank you.
Thank you both.
Let's see, David has his hand raised.
Yeah, if we still have time for a quick question, I had one for Terry. One thing that I think a couple of our research streams could potentially merge here, something that Dr. Claire Knox and I have worked on, is the idea that FEMA reimbursements for disasters have been particularly impactful for local governments in Florida, especially the smaller ones, because they're essentially having to front the money that they spend on disaster response, and then they wait 6 months, a year, maybe 2 years to get the money back from the federal government. Have you seen any of the instances that of these communities that are already in fiscal distress, that a natural disaster has come along and thrown off their progress, or just completely, or has it had any effect?
The city of Miami Shores, which is in Miami-Dade County, It's south of Fort Lauderdale. It's near North Miami. They had an issue where they had to take out a large loan in order to front the money for the disaster relief. Now I've heard there's just few case studies that I've heard floating around where there's distress and it's taking the federal government or that's funneled through the state so long to get them their money. You're right, up to like 6 years. I mean, as of in 2017, there were still cities waiting in Louisiana for their reimbursement from Katrina. So the reimbursement that actually happened for the last hurricane was a lot faster than that. And that's because we have FEMA going at a better pace. So will that have impacts on financial sustainability later? It might be a good lesson because we can't count on state money or federal money to come in. There's the importance to be self-sufficient. So
yeah, we've heard anecdotally that a lot of these small communities are having to set aside disaster reserves, essentially, that so they can actually do the operations they need to respond, and then use that reserves to wait out the federal government, which is completely inefficient use of their very limited funds.
Or take loans out with high interest rates. So you're right. It is future research, and it's appropriate.
All right. Well, we want to thank you. Our time is up. I know that there's a lunch break until 1:15, but also too there is a poster session I think that is ongoing now during the lunch hour. So if you want to go in there and just kind of peruse and talk with various students there as well. Terry?
I want to make a correction. I said Miami Shores. It's El Portal. So in case you looked that up, sorry about that.
Okay. All right. Well, thank you. Let's give everybody a hand.